the agenda. Hopefully, we are joined online by Professor John Clarkson from Cambridge University.
Yes, I'm
Check
here.
with the online team whether that's the case.
I hope you can hear me.
I hope so, otherwise it's going to be 20 minutes of me giving an interpretive dance routine or something like that, which is a joke I shouldn't make because people will hold me to it. So, yeah, no one wants to see that.
Be happy to share my slides from here, but you need to take down the slides that are already there.
Excellent. So we have John Clarkson with us. Just trying to get the slides up on the screen. So Professor Clarkson is based at Cambridge University and also part of the healthcare systems at the Technical University of Delft. And it's appropriate, one of the things that Malin mentioned was universal design, because Professor Clarkson was instrumental in the development of the inclusive design toolkit, which she'll be talking a little bit about today, and its follow-up tool, improvement. So thank you very much, John.
Thank you. It's a real pleasure to be with you here today. So thank you for inviting me. And what I thought I'd do is take on a journey from where I started in school to where I ended up pulling together ideas of inclusive design with systems thinking. So I was very fortunate to go to a very old school in the southwest of the UK. And what I studied was math and music. I probably spent far too much time doing music and not enough doing math. So then I went to work with an engineering company, and I was involved in designing the camera tube, studio camera tube you see on the left of the picture, and then the broadcasting equipment you see on the right. And I learned that although these are electrical devices, they performed only because of their mechanical design as well, and their architectural objects, which I guess I learned about systems by starting in that job. I then studied in Cambridge at Trinity Hall, and I did a PhD in stepping motors. And I was particularly interested in what happened when they try and run at high speed. And I wasn't as good as maths as I maybe thought I was. It took me nearly 2 years to develop the question on the lower part of that slide and to understand what it looked like. And it's that shaded area on the right that shows why these motors had trouble running at high speed. And again, it's not just about the electrical component, it's about the physical world you connected into. And then I worked for a company called PA Consulting Group, a technology consultancy, where I really learned how to be an engineer. And I was involved in developing the controls for a fire training system for the Navy. I was in charge of safety for making new beer in a can, and that was fun. But I also did work on putting computers in inhalers so that we could undertake clinical trials. And all of that work led me to the conclusion that engineering was simply two questions. How can we do it better? And what could possibly go wrong? And it's the balance of those two questions that really was what engineering was about. But more importantly, it's actually all about the process you take to answer those questions. So at that point, over 25 years ago, I went back to university, to the Department of Engineering in Cambridge, and I started looking at those two questions. So it was mentioned I did work on inclusive design, so a lot of my focus was on the question on the left-hand side initially, how can we do it better? And you might be excited by this sort of car, a Jaguar, and I was excited because I was driven around the test track by a professional driver. And this is a vehicle that defies most of the rules of physics. But I'm also particularly excited by things like this jam jar, this easy open jam jar. And it is what it says, it's easy to open. And that is a delight when you use something like that. And then there are things I find less of a delight. This is an attempt to make a thermostatic controller for your heating more accessible. And physically it is, but in terms of its visual qualities and its cognitive challenge, it is awful. So we focused then on inclusive design, and this concept that it's normal to be different. We're looking at diversity across the whole population. And initially, and I think rather naively, we focused on people who would be excluded. So we were trying to understand in the real world where the demand of a product or a service or a system working with us was greater than our capability to respond, and that would lead to exclusion. But then in looking around that world, you find some curious things, that even this Ferrari was designed to be inclusive because the average age of the driver was over 55, and it's a better vehicle because of that. And then Roberts, in designing their radio, the digital radio on the right-hand side here is made to look like and behave like the old analog radio on the left. With the whole idea of, from a mental model perspective, it was much easier for the older user to go from the analog to the digital. And it's through observations like that that we really realized it's not just about exclusion. When we see the things that might lead to exclusion, they mirror the things that might make it difficult for somebody to engage or frustrating to engage. So what we thought was a minority issue is actually a majority challenge for the product or service provider. And we talk then about inclusive design just being better design. And my team have been looking at gloves and glasses that would help people begin to empathize some of the challenges of dexterity or visual challenges. We've looked at how we might predict how many people might be excluded from using a product or service, really more just as a challenge to help them do better. And then back to process. We wanted something simple that was an inclusive design process. So explore, create, evaluate. What are the needs? How can the needs be met? And how well are the needs met? And it's so simple, it wraps around anybody's existing design process. And we worked with a lot of different organizations, some in the UK, some international, training their designers to think more inclusively. And it led to people like Unilever designing better accessible packaging. And even when you get inside, it's easier to see what's in the box. More recently, we've been working with the international team looking at what they call the hero images, the images used for advertising product online, typically with the supermarket. And the image on the right conforms to the new standards where it's easier to see what the product is and easier to see exactly what it says it is and how big it is. And this is now part of the international guidance, and it's changing the way we shop online. And going the other way, we've taken the idea of explore, create, evaluate into the schools. So for 12 and 13-year-olds, it's in the national curriculum. We've developed resources that help the teacher to teach the students to design and to design inclusively. So the teacher might set the challenge with the children and they explore the parameters of inclusion, exclusion, good design, bad design around particular product challenges. And one we have looked at is an inclusive design of an inhaler system for use with children, because too many children die because of the lack of use of the inhaler. So the children are designing the pack for other children. And one of the prototypes is now being tested in the London hospitals to see how it helps children use the inhaler better. And you can see here the beginnings of the crossover from the product to the system. And at the same time, we've been looking at the other half of the questions, the what could possibly go wrong. And we've been working with the chief medical officer at the time, it was about 15 years ago, on looking how design might improve patient safety in healthcare. It was a system-wide design-led approach to tackle patient safety in the NHS, the National Health Service in the UK. The pictures in this report are extraordinary. So for example, human beings make mistakes because the systems and processes they work in are poorly designed. It's a systems challenge. And another one, too many healthcare solutions have been designed based upon a paucity of knowledge of the system into which they will be placed or the needs of the people who use them. So that inclusive design and systems challenge. And again, we developed a simple process. How to examine, assess, and then improve. What is going on? What could go wrong? What can we do about it? And we've been applying those ideas again for health and care organizations in and around the UK and beyond. And then the opportunity came to bring these two questions back together. So the Royal Academy of Engineering in the UK asked me to chair a working group, say, well, how do we understand what a good approach to design or improvement in healthcare might look like? So we had to work with the health and care professionals to explore how engineers can add to current understanding and practice of systems engineering in quality improvement and healthcare design. So we ran some workshops with patient leaders, clinicians, physicians, and pharmacists, systems engineers, and improvement professionals. And the challenge was interesting because systems that work do not just happen. They have to be planned, designed, and built. Often difficult when things already exist. And the traditional engineering model of systems engineering is brilliant, but very difficult to understand. So we just took a step back and we said, it's about systems, design, risk, and people. And we ran workshops in each of those areas to explore what they might mean. So when we talk about systems and systems of systems, the healthcare professionals understand this very well from the perspective of the human body. But we could also think of the patient going to see the general practitioner, seeking help for some condition. They're given a prescription and they take that prescription to the pharmacist. And then that's translated into the medication with the instructions that goes to the patient and their system at home. And if all of those things are working, and the research and the manufacturing and the delivery is all working, then the patient can take the right medication in the right dose at the right time. So the questions that come out of this, well, who are the stakeholders? Who are the people who have an interest in making that work? What are the elements or parts of that system, and how does it perform? That's the systems view. From a design perspective, we're inspired by the double diamond model from the Design Council. And that interesting challenge of saying, how do we explore the need to define the problem before we then look for the best solution? And we can apply that to something like a simple blood pressure monitoring equipment. Or you can apply that to a piece of equipment within a set of equipment within the complex environment of theatre. Or you can take a different view, and this is a scanner for use with children, and you promise the child an undersea adventure. The rumblings of the scanner is the submarine engine, and you're told to keep really quiet and still so nobody knows you're under the sea. And what comes out is a better scan image, and the child's so excited they want to come back tomorrow and do it all again. And what are the questions from the design point of view? Well, maybe no surprise that what are the needs? How can the needs be met? How well are the needs met? The questions from inclusive design. When we think about then risk, we're trying to avoid accidents, but we're also trying to learn from what we do that is exceptional. And again, we can apply that to simple things, maybe like putting a line, a central line into a person in theatre. And we know there's a point in that cycle, if you interrupt the doctor, they may forget whether the line they're just about to grasp in the picture is in or out of the patient. It doesn't kill people, but it's really inconvenient to go back and pull the line out afterwards. We can apply that same way of looking at risk for a change in shift in the hospital. What could possibly go wrong as one team swap with another? And then people sometimes make mistakes. We have Lewis Hamilton, 2013 in Malaysia. He's been racing with McLaren, and he's just changed to race with Mercedes. And he comes into the pit in the race, and he stops with McLaren. And they just wave him along. down to Mercedes. So people make mistakes. So how do we then help them, help the system to accommodate that? So the questions, what is going on? What could go wrong? Or what do we do well and how do we make it better? Those questions from the risk from before. And then there's the people side, and we were thinking about diversity in the patient population, the provider population. So why do we give medication to somebody with arthritis when they're struggling to open a jar? And why do we give it to them in a child-resistant container? And this is the same picture as before, but no glasses, first thing in the morning. One of those medications you must take once a week. And if you take it once a day, you die horribly. And yet we make them all look the same. And what about language? Is it simple, clear, concise? Always the same language when we explain what we're doing in healthcare. So the questions might be, who will use the system? Where is the system? What affects the system? And it's a bit like the juggler, that the performance is only complete if we can keep all the balls in the air: people, systems, design, and risk. And we can put all of those questions together, and it forms a natural cycle, starting at the top. And most of the questions on the right are about what is the problem, and most of the ones on the left, what is a good solution. And within that, the ones I've highlighted come from inclusive design, thinking about people. So at that point, we had a way of describing what is a systems approach, what is engineering better care. 2 questions. And then I brought it back to my own team in the university. And I want to design a toolkit to make it easier to do this. So what I did is introduce process. So we want to understand the context, define the problem, develop the solution, collect the evidence, and underpin that by making the case, manage the plan, and we have to agree the scope. And we can add that into a process where we want to go from the current performance to something measurably better. And that brings us more questions, a few more in the cycle. But again, inclusive design is at the heart of this systems approach. And if I put the questions around the hexagon, what you see is that the majority of the questions are on the left-hand side. They're about the context and the problem. And that's so important to have the right problem, and then you can go away and find the best solution. And the toolkit has cards that help understand who the stakeholders might be, what the activities or tools or questions might be that you're trying to solve. And we talk a lot about stakeholders and mapping their needs. We have a canvas where we try and capture what we know about the context, the problem, the solution, the evidence. And we use that to help us define the plan to deliver the improvement. So there we have it. We have these challenges there about how do we do it better, what could possibly go wrong. It's a systems view, but based very much on inclusive design. So where next? If we look at the impact, where we might want to go, we've been working with the government in the UK, looking at how we get patients from the hospital back into home. How do we make fundamentally that a good system, but an inclusive process? We've been working with the Scottish government, trying to understand how we design new policy. How do you go from gas heating of the home to an electrical heat exchanger? And how do you do that using inclusive design so that the people affected by your policy are taken into account throughout the process? I talked about education before. So we're taking this way of thinking to the graduate and undergraduate level, as well as schools in the UK. Also taking it into hospitals and training people who do improvement. And there's a particular group in the northwest of the UK where 5 hospitals are learning how to design inclusive improvement. And then research, which takes a bit of a slower pace maybe than the others. We're still working to see how we can improve work in hospitals, how we can improve work in mental health and in the community. But we're also taking this idea into the environment. How do we rethink and redesign the way people live and farm in the environment and take an inclusive systems view? And finally, we're also training people how to design research using an inclusive systems-based approach. And in summary, we have this way of thinking that came from inclusive design, that came from thinking about risk, but acknowledging that almost everything around us is a system. So how do you take those concepts and extend it into that world of systems and encourage people to be inclusive in the way they work with people and design for people, but in a systems environment? So thank you very much for listening. Appreciate that.
Thank you very much, John. I'm conscious that I stand in a dangerous position because I'm all that is between you and the coffee that I think we've been promised at the break. I did wonder, however, if this, because we haven't had the time for any questions yet, I wondered if people would be happy to perhaps take 5 minutes now before the break to, if we did have any questions for any of the speakers, be it John, Malin, or for, oh no, my brain's gone. June, if June is still with us. So does anybody have any questions? Or is anybody monitoring the chat, just in case there are questions there? Give everybody a moment. They might be decaffeinated. That's the problem. So maybe we need the coffee before we can get the brain working.
Thank you very much, John, for being with us. We definitely will think about the inclusive design while we are working with our project, Muse IT. Hopefully, we have opportunity to talk to you again at another time and work with our program. So yes, please have a quick cup of coffee, bring it back so we can keep up with the timetable.
Okay, thank you. We'll see you back at 3 o'clock.